Hi, everybody. I hope you had a great week. Welcome back. Learning about hearing disorders. Okay, this week I was assigned otitis media. Okay, otitis media. What is it? So, otitis media is an infection of the middle ear. It is associated with colds and upper respiratory infections. The eustachian tube becomes blocked from the infection caused by the cold and the upper respiratory infection. Because the eustachian tube is blocked, there creates a buildup of fluid. And so your eustachian tube is connected to your nose, your throat, your mouth. And so when you get a cold here, it can travel up through your eustachian tube and infect your middle ear. Because of that, the infection can cause a collection of thick mucus or pus in the ear. And yeah, like I said, it's bacteria from the nose, the mouth, or the throat. And if the buildup becomes super thick, this can actually cause an obstruction with the movements of the TM and the ossicles. So this is it can decrease the mobility of the TM and the ossicles. It can like hinder it completely. And this can cause a conductive hearing loss. If the pressure, so if the fluid's like super thick, it's going to create this immense pressure in the middle ear. And so that pressure from the infection can actually cause the eardrum to rupture. Signs and symptoms of otitis media. So like I said, severe pressure, severe pain. This can also cause the individual to develop a fever. It can be 100.4 and anything above that, which is, I mean, that's kind of crazy. But if you've ever had an ear infection, like I get them all the time, and they are so uncomfortable to sleep with. That's supposed to say disruption of sleep, not description of sleep. But yeah, I mean, like, you're going to have this incredible pain and pressure in your ear. And so the more you move, the more it's going to be bothersome, and it can be so painful that it wakes you up. Patients also often say that they feel like their ears feel plugged. Otitis media can also cause dizziness, imbalance, which could lead to nausea and vomiting. If the eardrum ruptures, the fluid will drain out of the ear. So there also might be draining from the otitis media. Okay. The statistics and the populations affected. So approximately 80% of children will be diagnosed with otitis media at some point in their life. And even more than that, 80 to 90% will have otitis media with effusion before they reach school age. Peak incidence, which is, I guess, the most, what am I trying to say? Like the time period that you're most likely to develop otitis media is between 6 to 12 months of age. Otitis media is more common in males than it is in females. It's much more common in children than it is in adults. And then I listed a few different populations who are more prone to getting otitis media. So for example, individuals who have a history of recurrent otitis media, individuals who have cleft palates, individuals who are immunodeficient, and individuals who are immunocompromised. And then etiology and pathology. So some causes and risk factors that I was able to find on otitis media include, like I said, upper respiratory tract infections, genetic predispositions. So I read an article that said if children have parents who have a history of recurrent otitis media, the children are more prone, or I guess more skeptical to getting otitis media. And then anatomical abnormalities like the cleft palate. And then bacterial pathogens, viral pathogens. Viral pathogens is actually the number one cause, which is usually just from a cold or an upper respiratory tract infection. And then allergies. Oh, and yeah, I mean, the genetic predisposition. So families who have a recurrent acute otitis media or otitis media. And then pathology. So otitis media is caused from the inflammation after an upper respiratory tract infection. The edema from the inflammation can cause a narrowing of the eustachian tube, which is going to increase the negative pressure in the middle ear, since the eustachian tube is supposed to equalize the pressure. If the eustachian tube is being decreased, then the pressure in the middle ear is the negative pressure will increase. And then once the negative pressure increases, it'll cause a buildup of mucosal secretion in the middle ear. And then from that buildup, an infection can occur from the bacteria or the virus that has caused the otitis media to begin. The site of lesion is the middle ear and the eustachian tube. Computer doesn't want to work. Okay. How's it diagnosed? So this is pretty simple. You go to an audiologist, an ENT, they're just going to do an examination, and usually it's able to be seen by the appearance of the eardrum being red and bulging, or the eardrum appearing indented. And then once the audiologist performs tympanometry, because of that increase in the negative pressure, the tympanometry will reveal that there is reduced pressure in the middle ear, and the decrease of the mobility of the TM and the ossicles will also show up on the tympanometry. And then this last bullet point, it's not super common, but some doctors might actually take a sample of the fluid in the middle ear and test the organism to see what's causing the infection. This isn't common. It's more so in patients who have otitis media that has lasted for like months on end, and they're not in, like, antibiotics aren't working, which, like, we'll get into the treatment of it. But if the medications and the at-home supplements they're doing to control the otitis media aren't working, then the doctor will, or they can test the fluid to see exactly what the infection is, so that they know exactly how to treat that infection. So treatment and management, antibiotics. This isn't actually like the number one treatment, I guess. This is more if it's severe otitis media. So, like, you're not always going to use antibiotics. But then again, not everybody goes to the doctor if they have an ear infection. It can be relieved by, like, painkillers. I mean, ibuprofen, Aleve, just over-the-counter stuff. And then for if you're waiting for the pain relievers to kick in or the antibiotics to kick in, application of a cold pack, a cold washcloth, or a heat compress, putting that on the ear and around the ear can provide at least temporary relief. Doctors might also suggest an antihistamine, which is just allergy medicine. That would be more if they are assuming the otitis media is caused by allergies. They also might suggest a decongestant if the otitis media is stemmed from a cold or an upper respiratory tract infection, and you have that buildup of mucus. A decongestant can help to break the mucus down, drain the fluid. And then if it's chronic, meaning it's lasting way too long, doctors can perform it's I wouldn't call it like surgery, but it's a procedure to create a small incision in the TM. This will relieve that pressure. The doctor can go in, they can suction out the fluid. They can also insert a tube so that they can allow for the fluid to continue to drain as necessary. And then if it's really bad and tissue has been infected from the infected fluid, then doctors can perform a surgery called, I practice how to say this, tympanomastoidectomy. They can perform a tympanomastoidectomy to remove the infected tissue, which in the end is going to help, or it's hopefully going to help, I guess, decrease the likelihood that the patient acquires otitis media again. And then I just have a short little video here. I didn't get to that. Oh, no, here it is. Okay, hopefully you guys are able to see this and hear it.
So bring it on.
But yeah, I mean, this video it just broke it down very simply. And so I don't know if like the way I'm saying this is all confusing, but it's just a really short video, but it explains everything very clearly and simply. So hopefully this helps.
Otitis media is inflammation or infection of the middle ear. The middle ear is the cavity between the tympanic membrane, the eardrum, and the oval window of the inner ear. Its function is to amplify sound vibrations of the eardrum and transmit them to the inner ear. The middle ear is linked to the upper throat by the auditory tube or eustachian tube. The tube helps equalizing air pressures between the middle ear and the outside atmosphere. It also drains mucus secretions from the middle ear into the throat. The eustachian tube is usually closed, opening only when the person is yawning, swallowing, or chewing. When atmospheric pressure changes rapidly, causing a sudden feeling of fullness in the ear, such as during airplane travel, these activities can be done on purpose to open the tube, allowing air passage to equalize the pressure. Otitis media develops when the eustachian tube is blocked, commonly as a result of upper respiratory tract infections or allergies. Mucus builds up in the middle ear, creating an environment for bacteria or viruses to grow. Otitis media can occur at any age, but it is most common in small children whose eustachian tube is narrower and more horizontal. The tube opening mechanism in children is also less efficient due to the angle between the tube and the muscle acting on it. Children also have larger adenoids, the pads of lymphoid tissue located near the opening of eustachian tubes. Adenoid swelling may block the tube's opening. Other risk factors include exposure to smoking, male gender, family history, pacifier use, bottle feeding, and attending a daycare center. There are several types of otitis media. Acute otitis media is an infection that develops suddenly. Fluid and pus accumulate inside the ear. The tympanic membrane appears red and bulging. Patients typically experience fever and ear pain. In some cases, the eardrum may rupture and the ear may drain. Chronic suppurative otitis media is an infection that doesn't go away or occurs repeatedly. Tympanic membrane perforation and ear drainage are common features. Hearing is usually impaired. Otitis media with effusion is when fluid continues to accumulate in the middle ear, even after the initial infection subsides. Patients may experience a feeling of fullness and impaired hearing, but there are no signs of infection. When fluid remains for an extended period of time or returns repeatedly, the condition is known as chronic otitis media with effusion. The primary complication of ear infections is eardrum rupture, which heals spontaneously in most cases without the need for surgical repair. Untreated recurrent or chronic infections may lead to hearing loss, speech and language development delay, and rarely, infection spread to surrounding tissues, including the brain. Treatment of acute otitis media includes pain medications and possibly antibiotics. Because the majority of ear infections resolve without antibiotic treatment, children with mild symptoms are usually observed for 48 hours before antibiotics are prescribed. For cases with prolonged effusion, a tiny tube may be placed in the eardrum to help drain the fluid. The tube usually falls out on its own after some time as the incision closes.
And then here are my references. Okay. Okay, guys. I hope you have a great week. Bye.